Good morning. My name is Katrin Lavarias. I'm a family nurse practitioner student from Purdue University Global. Thank you for making time with me to discuss about our patient. I assessed him earlier. His name is with the initial of VH. He came here with a chief complaint of cough and runny nose for the past 3 days. He used NyQuil, but it doesn't help him and it makes the cough worse. He denies any past medical history or surgical history. He don't have any drug allergy. For medication, he's taking ibuprofen for pain. Family history, his mother and father are alive and well. Social history, he don't have any, he denies smoking and he drinks alcohol 1 bottle every night after work, and he has a history of drug use back in 1990 with a cocaine use. General assessment, he denies fever, chills, loss of appetite, or any weight gain. He denies any chest pain, palpitation, or any cardiac disease. He denies any shortness of breath, but he is complaining of cough and also sore throat. He don't have any changes in his skin. He denies any hair or nails changes. He does wear glasses, but he denies any eye pain. He denies any ear pain or hearing loss or tinnitus or vertigo. Um, his sinuses are he denies any problems with his sinuses and any change of smell. He complains of sore throat but denies any dental problem or denies any changes in speech or swallowing. Neck, he don't have any neck pain. Gastrointestinal, he don't have any abdominal pain. He denies any changes in bowel movement, denies any nausea or vomiting. Denies genitourinary, he denies any urination changes, hematuria or dysuria. Musculoskeletal, he denies any muscle pain or any bone fracture or weaknesses or tenderness. For his latest vital signs, blood pressure is 132/65, his heart rate is 75, his temperature is 37.1, his oxygen is 98, and his respiration is 20. His weight is 168 and his height is 5'7" in height. General appearance, he is alert oriented. He is appearing well and well nourished, not in distress. He has a normal mood or affect. He can ambulate without any difficulty. His eyes are equally reactive to light and accommodation. Both ears are intact. Nose are no obstruction that I noticed. Septums are in midline. Mouth mucosa are pink and intact. Tonsils are not inflamed. Tenderness, no tenderness on the neck that I noticed. No jugular vein distension that I noticed. The neck is flat to touch. S1 and S2 are noted. No murmur. Peripheral vascular, there's no swelling on the hands and feet and upper extremities. Lymph nodes are no normal findings. Respiration, regular, unlabored, and easy breathing, although there is a expiratory wheezing all throughout. On assessment, gastrointestinals, abdomen are soft and no tenderness. Genitourinary, there's no changes with urination, like he said earlier. On assessment, there's no abnormal findings noted. Musculoskeletal, all extremities are well, gait and coordination are normal. Neurological, alert oriented ×4, no loss of consciousness. For my assessment, the final diagnosis will be viral upper respiratory infection. With this, I usually last between 2 to 3 weeks, and he does not need antibiotic. Another clinical differential that I can tell is bronchitis and allergic rhinitis, but for my primary diagnosis, it will be the viral upper respiratory infection. And for the plan, I plan to order for CBC, blood count, and CRP. I would also recommend benzonatate 100 milligrams per day. With this, I will recommend him to follow up as needed, and balanced diet, lots of water, and exercise. And that's all. Thank you for